Anxiety and Panic by Edmund Bourne is a comprehensive self-help guide for individuals experiencing anxiety disorders and panic attacks. Bourne, a clinical psychologist with extensive experience in anxiety treatment, provides both a theoretical understanding of anxiety and panic and practical tools for overcoming these conditions. His book addresses a wide range of issues associated with anxiety, from the biology of anxiety to effective therapeutic techniques, and offers a practical roadmap for individuals seeking to manage or reduce their symptoms. Understanding anxiety and panic. At the heart of anxiety and panic is an understanding of what anxiety and panic are, both as psychological and physiological phenomena. Bourne explains that anxiety is a normal human emotion, often triggered by stress or uncertainty. It is a natural response to situations perceived as threatening. However, for those with anxiety disorders, the level of anxiety can be disproportionate to the situation at hand and persist long after the stressor has passed. Panic attacks, which are sudden and overwhelming episodes of fear and discomfort, are discussed in detail in the book. These attacks often occur without warning, sometimes in seemingly benign situations, and can be extremely distressing. They are characterized by physical symptoms such as rapid heart rate, shortness of breath, dizziness, and a sense of impending doom. Panic attacks often lead individuals to avoid certain situations, which can severely restrict their daily lives and activities. Bourne highlights the fact that anxiety and panic are not merely psychological states, but also involve physiological changes in the body. The fight or flight response, an evolutionary mechanism designed to help humans deal with danger, is often activated inappropriately in individuals with anxiety disorders. This leads to the physical symptoms that accompany anxiety and panic, including elevated heart rate, muscle tension, and hypervigilance. Causes of anxiety and panic. Bourne emphasizes that anxiety and panic disorders are multifaceted, with multiple contributing factors. Genetics can play a role, as individuals with a family history of anxiety disorders may be more prone to experiencing anxiety themselves. Additionally, environmental factors such as trauma, stress, and negative life events can trigger or exacerbate anxiety. For example, the loss of a loved one, financial difficulties, or ongoing work stress can all increase vulnerability to anxiety. Cognitive factors are also critical in understanding anxiety. Bourne explores the idea that individuals with anxiety disorders often engage in negative thinking patterns, such as catastrophizing or worrying excessively about potential threats. These cognitive distortions can amplify feelings of fear and lead to more frequent or intense panic attacks. Bourne's focus on cognitive patterns is central to his therapeutic approach, which involves challenging and reframing these distortions. Treatment approaches. One of the main strengths of Bourne's book is its emphasis on evidence-based treatment strategies for anxiety and panic disorders. He presents a range of therapeutic interventions, each backed by scientific research and practical application. These strategies are designed to help individuals reduce the frequency and intensity of anxiety and panic attacks and ultimately regain control over their lives. 1. Cognitive Behavioral Therapy, CBT. Cognitive behavioral therapy, CBT, is one of the most effective treatments for anxiety and panic disorders, and Bourne dedicates a significant portion of the book to explaining its principles and techniques. CBT focuses on identifying and changing negative thought patterns that contribute to anxiety. By challenging irrational beliefs and replacing them with more balanced, realistic thoughts, individuals can reduce the intensity of their anxiety and panic attacks. Bourne provides practical exercises that help individuals recognize and alter cognitive distortions. He also emphasizes the importance of self-monitoring, where individuals track their anxiety levels and the situations that trigger them. This awareness allows for a more targeted approach to managing anxiety, as individuals can work to address specific triggers and modify their responses. To relaxation and breathing techniques. Another key strategy discussed in the book is the use of relaxation and breathing techniques to manage anxiety symptoms. Bourne explains how deep breathing exercises can activate the body's relaxation response, counteracting the physiological symptoms of anxiety. He provides step-by-step instructions for various relaxation techniques, such as progressive muscle relaxation, deep breathing, and visualization exercises. Relaxation techniques are particularly important for individuals who experience panic attacks, as they help to calm the body and mind during an episode. By practicing these techniques regularly, individuals can develop a sense of control over their anxiety symptoms and prevent the escalation of panic attacks. Exposure therapy is another technique that Bourne discusses in detail. This therapeutic approach involves gradually exposing individuals to the situations or stimuli that trigger their anxiety in a controlled and systematic way. The goal of exposure therapy is to help individuals confront their fears and learn that their anxiety response is often exaggerated or irrational. Bourne emphasizes that exposure should be gradual and tailored to the individual's specific fears. For example, someone who experiences panic attacks in crowded places might begin by imagining being in a crowded space before moving on to visiting less crowded areas. Over time, the individual's anxiety response decreases as they learn that their fears are often unfounded. 4. Lifestyle changes. In addition to therapeutic techniques, Bourne also discusses the importance of lifestyle changes in managing anxiety. Regular physical exercise, a balanced diet, and sufficient sleep can all play a significant role in reducing anxiety symptoms. Exercise, in particular, is highlighted as an effective way to release built-up tension and promote relaxation. Bourne also suggests that individuals with anxiety disorders pay attention to their thought patterns and develop a more positive mindset. Practicing mindfulness, engaging in hobbies, and fostering social connections can all contribute to overall well-being and reduce the impact of anxiety on daily life. Medication and other interventions. While Bourne emphasizes non-pharmacological interventions, he also discusses medication as a potential treatment option for anxiety and panic disorders. Medications such as selective serotonin reuptake inhibitors, SSRIs, and benzodiazepines are commonly prescribed for anxiety. Bourne explains that medications can be helpful in the short term, especially for individuals with severe symptoms, but they should be used in conjunction with other therapeutic approaches to address the underlying causes of anxiety. Bourne cautions that medication should be used cautiously and under the guidance of a healthcare professional. He stresses that relying solely on medication without addressing the psychological and behavioral components of anxiety may lead to relapse or recurrence of symptoms once the medication is discontinued. Overcoming the stigma of anxiety. Throughout the book, Bourne also tackles the stigma associated with anxiety and panic disorders. Many individuals with anxiety may feel ashamed or embarrassed about their symptoms, which can prevent them from seeking help. Bourne encourages readers to understand that anxiety disorders are common and treatable conditions, and there is no shame in seeking help or undergoing treatment. He stresses that early intervention is key to managing anxiety effectively, and the earlier an individual seeks treatment, the better their prognosis. Bourne's empathetic tone and practical advice provide reassurance to those struggling with anxiety, helping to break down the stigma and encourage individuals to take proactive steps toward recovery. Anxiety and Panic by Edmund J. Bourne is a valuable resource for anyone struggling with anxiety or panic attacks. With its comprehensive coverage of the causes and treatment options for anxiety disorders, the book offers both theoretical insights and practical tools for managing symptoms. Bourne's focus on cognitive behavioral therapy, relaxation techniques, and lifestyle changes provides a well-rounded approach to overcoming anxiety and panic, and his emphasis on understanding the physiological aspects of anxiety helps readers to better comprehend and address their condition. Whether used as a self-help guide or as a companion to professional therapy, Anxiety and Panic provides essential information and support for individuals seeking to regain control over their lives and improve their mental health. Let me know if you need any other changes.